Yeah.
First, when we're starting with endocrinology, unfortunately, I don't want any of your listeners thinking that they can go to their endocrinologist and get full proper thyroid care. I just haven't seen it done. I'm just speaking facts. And that's not a bash on the endocrinologist. That just is, right? They're very, very good at managing diabetes. But when it comes to the thyroid, despite it being part of the endocrine system, they fall flat. And here's why. 93% of Americans are insulin resistant. Being insulin resistant alone can increase reverse T3 and hinder that T4 to T3 conversion.
Hello and welcome to the show, Dr. Amie Hornaman. We're so glad you're here.
I'm so happy to be here. Thanks for having me.
This is a very connected disease alongside chronic disease like type 1 diabetes. So this is really important. And I'm so thrilled somebody with your expertise can come in here. And, I'd like to start with your story. And it's incredible. And I think that really does lead to where your passion comes from, and myself included, because, I've lived with type 1 for 44 years now. So we get it. We've been through all the ups and downs and all the things that didn't work. And then we're advocating for the doctor. So I appreciate what you're doing in this space and that you're here talking to my listeners today. You're known as the Thyroid Fixer. Tell us a little bit about where it all began for you.
So for me, like so many of us in this space, pain to purpose story. So this goes back 25, 30 years when I was competing in bodybuilding competitions, fitness figure. I was more on the feminine side. And I didn't build my body to look like a dude, but a little more on the feminine side. But I had to get my body in the leanest shape possible while maintaining musculature. So that was always a challenge, but I loved the challenge and I loved doing it and worked with a coach and did plenty of shows. I knew, what the process was. I knew what was involved. So I was all in. This one show I was getting ready for was a really, really big national show. And I'm working with my coach and I'm sending him my progress pictures, my weight every single week. And every time I'm messaging him, the scale's going up. So here's me. I'm hesitating. I'm like, yeah, I went up 5 pounds this week. No, I'm not eating donuts. And we could not figure out what was happening in my body. It didn't make sense. Biologically, it didn't make sense that when you're restricting calories and you're expending energy at the gym, the scale should be going down. So I did what anybody would do. I went to my doctor and I said, here's what's going on with me. My body feels like it's a runaway train. Like it's escaping my grasp right now. I can't control anything that's happening inside of my body. And he looks at me and looks at the test that he ran and goes, well, I don't know. There's nothing to see here. You're normal. Everything's fine. So, no answer. So I left his office and I'm like, well, there's the second opinion thing. So I'm going to go for a second opinion. So I go for a second opinion and a third, a fourth, a fifth, a sixth. I went to 6 different doctors. All of them told me that I was normal. Fine. Eat less and exercise more, one of them said. So by that time, I was deepening my level of depression, frustration. I was hiding my body at the gym. I was embarrassed. I felt the stares. I felt the judgment because everybody blames you when you gain weight. It must be your fault. You must be eating the donuts and pizza, right? But I wasn't. I really wasn't. I really was doing all the things. And this is what I hear from my community to this day. I'm doing all the things. So I went to doctor number 7, still holding on to hope that somebody would figure this out. I mean, at that point, I was praying for any diagnosis because that would at least give me a name for what was going on with my body. It would give an explanation. And the 7th doctor finally said to me, well, it looks like you have Hashimoto's, i.e. hypothyroidism. There's a problem with your thyroid. And here's a pill. Like I thought the skies opened up and angels started singing. I'm like, this is amazing. I now have a name for what's going on with me. And I have a pill that's going to fix me. That pill was levothyroxine or Synthroid. And the reason why I like mentioning it is because it's the second most prescribed drug in the United States. Many of your listeners are on it already. And it does nothing. So she gave me the inactive thyroid hormone, T4. And I learned this later through research because I took that little pill for 5 months and it did absolutely nothing in my body. And I didn't lose a single pound or feel any better. So that's when I started Dr. Googling and I'm like, wait a minute, this is an inactive thyroid hormone? I don't have a single receptor on any cell in my body. The 40 trillion cells that we have in our body, I don't have a receptor site on it for for T4, but I do have a receptor site for T3. Oh, look at that. T3 is the active thyroid hormone. So I'm finding this information out and I'm getting excited and I take it back to her and I say, look, there are doctors out there pairing up T3 with T4 because this inactive thyroid hormone, it does nothing. Let's add in the active thyroid hormone, skip the middleman, and let's get down to business here so my body can start changing. She goes, that's not standard of care. I don't do that. I said, well, thank you. You're fired. I'm going to find someone who does.
Yeah.
That's what led me into the world finally of functional medicine. And my functional medicine practitioner who I found, who sat with me, I always joke about this, sat with me for 83 more minutes than any other doctor, right? So it wasn't a 5 to 7 minute visit. It was actually time spent going through my labs, explaining to me how my body works, explaining to me why that T4 only isn't going to work, will never work, and doesn't work for most people to get them optimized, and actually put me on the right path. So it was at that point of time, after going through a major medical system too, by the way. I wasn't in like podunk nowhere. I was in a major medical system, UPMC Pittsburgh, which is equivalent to Mayo Clinic, equivalent to the Cleveland Clinic, where everybody travels to get the best of the best care. So I was in a system that I was supposed to get the best of the best care in, and I didn't. I got 6 misdiagnoses and 1 mistreatment. So that's what led me into doing what I do now, because people need help. They need help badly. Even 30 years later, we see the same thing now than what I experienced 30 years ago.
Wow. You literally became your own doctor.
Had to.
Yeah. Isn't that incredible? Yeah. Well, let's start with the basics as far as the thyroid. There might be some listeners that are aware of it. Maybe it's something they're getting tested, and we're definitely going to dive into the testing because I know full thyroid panel is ideal, and you'll explain more than that in just a minute because it's all about finding out the whole story. We talk a lot about that here on the show. A little piece here, a little piece there doesn't really fix anything or solve the root cause. So thyroid is a perfect example of that, isn't it? But what are the basics? What does that little but powerful gland actually do?
So to summarize it very simply, and this is something everyone will remember, from head to toe, it runs the show. So when you think of the 40 trillion cells in your body, and as we already said, that every single one of those cells has a little receptor site on it for that active thyroid hormone T3. But when we're talking about what we notice and experience, literally start at your head. The hair growth, your brain function, your memory, your mood, focus, concentration, your eyesight, the outer corners of your eyebrows even start to fall off or kind of go away and disappear when you have a thyroid problem. You can be cold when everyone else is comfortable. Obviously, your metabolism and your ability to burn body fat, your ability to put on muscle, your ability to poop every day, bloating, constipation. That's a really very, very common symptom. Dry skin, cracked elbows, cracked heels, brittle nails, brittle toenails, joint pain, migraines. I mean, literally from head to toe, the thyroid runs the show. So it even controls your cell turnover. It controls your immune system. It controls your heart rate and your blood pressure and your insulin and glucose blood sugar control. So it has say over every single organ and every single system of your body.
Okay. Hence the name, master hormone.
Right.
Gland, right? Master gland, master hormone. Yeah, master gland. So why would my listeners, a majority of them living with, and you know, something I like to say here is insulin dependent. There's a couple different types of insulin dependent, or I should say different types of diabetes, even type 2s, those living with the metabolic kind of area of health right now that they're managing. But so why should we be paying closer attention? Why does it tend to be something that's paired, unfortunately, alongside diabetes?
Well, number one, I think we have to look at the thyroid because what I just said, it's controlling our blood glucose. So now when we normally say that, as you know, in this world, everybody thinks type 2, right? Because type 2 diabetes is getting such a spotlight with the GLPs and everything. So everyone thinks when you say blood sugar or glucose, they immediately go to type 2. But we forget about type 1, and it still is having say over even if your pancreas isn't producing enough insulin, right? And we know, it runs the gamut. Some type 1 diabetics are, fully insulin dependent, and some just need a little bit of help as their pancreas is still producing some. So the thyroid really has a say in that as well. And what I've seen in our practice is when we improve the thyroid with type 1 diabetics, we can ultimately reduce the amount of insulin required, which really is the ultimate goal. Because when we're talking about insulin, as you talk many times about, it's good and bad. It gives us life, but we don't want too much because then it becomes the fat storage hormone. So you have to find that beautiful balance and that sweet spot. And if we can win a little bit of a battle by lowering the amount of insulin that you require because now your thyroid is working better, then that's a win.
Right. Yeah. Not to mention all of the physiological effects that that's going to do. So, it obviously trickles down to all areas of the body too. So this is so interesting. So endocrinology visits, I've been going for years now. Periodically, they'll check your thyroid. They'll run the tests. But what you're explaining has never been said so, and you did it in such an eloquent way because it's so simple. It really is simple how connected it is. But how many endocrinologists are really and their hormone, they are specialized in the hormones of the body. But again, even though they're still looking at a patient that may have insulin-dependent diabetes and the likelihood that maybe one day it would impact the thyroid gland, don't you think it's important for them to be testing this yearly, annually, and of course paying attention to symptoms because I'm big about that. We got to listen to what our body's telling us because that's going to give us a clue, having that conversation, that longer visit with the doctor to unpack some things, because even with type 1, we could become insulin resistant, right? So like you say, we are just needing more. And that is another sign, the body is not processing it properly, but how important that wonderful little thyroid gland has in that puzzle.
Absolutely.
Yeah.
So lots to unpack there. First, when we're starting with endocrinology, unfortunately, I don't want any of your listeners thinking that they can go to their endocrinologist and get full proper thyroid care. I just haven't seen it done. I'm just speaking facts. And that's not a bash on the endocrinologist. That just is, right? They're very, very good at managing diabetes. But when it comes to the thyroid, despite it being part of the endocrine system, they fall flat. And here's why. In medical school or even in specialized training, when they go to endocrinology, specialization, they're still only learning this very basic, we'll say linear model of thyroid treatment. You test TSH. If TSH is actually flagged high, you get a little red mark. It's got a little H next to it. So it has to be out of the range, which that's debatable in and of itself. We'll come back to that. You test TSH. If it's high, you give T4, that inactive thyroid hormone that doesn't work. And then you pat them on the back, wish them good luck, tell them we'll retest them in 6 months. And, Sally, that's all you need is that Synthroid. You don't need anything else. You're fine. Then they retest Sally in 6 months and Sally's TSH has come within normal limits. So now the endocrinologist is happy. And now he goes, Sally, your thyroid is good. And meanwhile, Sally's like, what gives? I'm still gaining weight. I'm miserable. I've lost half of my hair. I can't get out of bed in the morning. I can't think. I can't remember why I walked into a room. I think I'm getting early Alzheimer's. And by the way, my glucose numbers suck too.
Yeah.
It doesn't care. It doesn't care because they're only testing TSH. Now, to break that down further, TSH is thyroid stimulating hormone. It's a brain hormone. It's not even testing your thyroid hormones. It's not even looking at how much active thyroid hormone you have in your body to attach to those 40 trillion receptor sites. It's looking at, is your brain talking to your thyroid? That's what TSH is. Is your brain doing a good job at sensing your body to see if there's enough thyroid hormone in it? And if there's not, it's going to start yelling at your thyroid and TSH is going to go up. Well, the TSH number has been debated for decades. It's one of the only markers where high means low, meaning the higher that TSH is, the lower and slower your thyroid is functioning. So that number used to go up to a 10. Then the American, I think, Endocrinology Society said, hey, wait, let's bring that down to a 6. And then over time, more and more docs have been like, we're seeing hypothyroidism closer like to a 4, 4.5. Okay. In functional medicine, we say 2 things about TSH. Number 1, we don't care whether you test it or not, but if you happen to get it checked, we want it under a 2. But that's the least of our concerns. We need to see the rest of the panel, free T3, reverse T3, we'll throw in a free T4 as well. Let's check that inactive thyroid hormone. And then let's check your antibodies to see if you have Hashimoto's. That is a true full thyroid panel. And without it, you really know nothing about your thyroid function.
Yeah. Yeah. Again, it's telling the full story for
Yep.
sure. Yeah, that is incredible. Yeah. And even if the patient is still symptomatic.
Yeah. Oh, yeah. The how do you feel? That's right.
I
You
know
have to
it.
layer that over. How do you feel?
I know. And, I think it's sad too, because I think it just kind of like, and I'll call it, well, it was kind of like a placebo for you, even though you know that it was, the levothyroxine, but you were intuitive enough to pick up on, well, I might be feeling a little bit better, but still not my best. And unfortunately, I think that's what, especially us women, we kind of settle. Maybe we're also getting older. Maybe we've had diabetes for many years. This is a tough disease. I'm hitting menopause. All the things are stacking up. I'm not supposed to have a lot of energy. I think that's really the sad part, is when we just get set and just think this is the way it's going to be. And when you, like you say, there's not a doctor that's going to look closer at more, like the testing results,
Right.
so impactful. So the full thyroid panel, you did mention it, and I'm just going to list it just so the listeners get it again. So the TSH, and again, that's kind of like the grand score. And that tends to be, I have a few ladies that are in my group coaching circle, and they know I'm talking to you today, and they're thrilled. There's 3 of them that are all on the levothyroxine. One of them just brought in the free T3. And I don't want to mess this up as far as how I'm calling these hormones. So definitely correct me if I'm wrong, because I continue to learn as well. And it's so interesting because, again, they're feeling a little better, but still. And I think the number one thing is that stubborn weight. So at the time of this recording, as we're talking, they are literally experimenting with different doses as we speak. So I'm really proud about that. And that's something that we do inside the group. If I don't know the answer, I send them to people like you, to different shows. I say, no, there's further testing that needs to be done. And I just equip them to have that conversation with the doctors. But it's so empowering, because they're not going to ask. They're not going to dig a little deeper unless we say, no, this is not good enough.
Well, I would love, if you don't mind, to speak to those women, because in speaking to those 3, I know I'm speaking to thousands at the same time.
Yes, absolutely.
Okay, ladies. So you're on Levo, you're on Synthroid, you're on T4 only. It doesn't matter whether you go up in the dose or down in the dose or fluctuate that dose up and down. It still is T4. Now, when we're talking about the labs, like we just talked about, the 2 most important markers you can get, free T3 and reverse T3. You have to get reverse T3 done every single time you test. And there's actually an Instagram post that I just put out recently that's kind of like a PSA announcement. If you're working with someone, functional, integrative, naturopathic, conventional, whoever, and they don't test your reverse T3, that is their way of telling you that they don't actually know what they're doing with the thyroid. Right. Because if you don't get that reverse T3, and I don't want to hear, well, they said they'll test it every other time. No, you test it every single time, because you all are on T4. And T4 thyroid medication has 2 paths it can choose to go down. It can go down the free T3 path. It can become T3, because that's what doctors have been taught. Just give that patient T4 and don't worry about it. Their body will convert it just fine over to T3. Yeah. We'll unpack that in a minute. So it can convert to free T3, which is what we want it to do, or it can convert to reverse T3. Now, what happens when that reverse T3 starts to climb? And my optimal reverse T3 is under a 12. So when you look at that reverse T3 standard lab value range, it goes up to a 25. I don't care what that range is. I want you less than 12. If it's above a 12, then that's telling me that your body is having a hard time taking that T4 and converting it to T3. And you say, well, what's the big deal of having too much reverse T3? Okay. Well, reverse T3 is our survival hormone. It's equivalent to when it's high, it's equivalent to you lying in a hospital bed fighting for your life. It's equivalent to your body going into hibernation like a bear in the winter. Everything shuts down. There is no possible way that you will burn fat, that you will feel good, that you will grow hair, that you will turn over your skin, that you'll have a good metabolism and brain function. No possible way when reverse T3 is elevated, because it's telling your body this person is dying. The problem is you're not dying and you're not in the hospital bed. You're just trying to live your best life ever, but you're not going to if you're on T4 only. It's not going to happen. We live in a world, and that thought process that's taught in medical schools of don't worry about it, it'll convert. That's what the body does. Yeah, maybe 100 years ago, but we are in a toxic soup environment right now with more EMF exposure and more stress than ever. 93% of Americans are insulin resistant. Being insulin resistant alone can increase reverse T3 and hinder that T4 to T3 conversion, as can many, 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 many other factors. So to assume that someone in this day and age is going to take T4 and convert it to T3, in my opinion, is medical malpractice, and it's wrong. You have to be on some form of T3, whether that's natural desiccated thyroid medication like Armour, or whether we're adding in liothyronine, which is T3, to your already existing T4 and adjusting that dose. It's about finding the right combination, dose, and ratio for you. But I can tell you with full confidence, if you're on T4 only, you're not going to be living your best life. And that's just the aesthetic part. You know, we talk about the weight and the hair and the energy and kind of the feels, but we also have to talk about you're also never going to get your blood sugar under control. And you're at a greater risk of cardiovascular disease, and you're at a greater risk of Alzheimer's and Parkinson's, and you're at a greater risk of cancer because your immune system isn't working properly to seek and destroy the cancer cells like it normally does on a day-to-day basis. So it's a serious issue. For those women that are on T4 only, I really want you to pay attention and go a different route. Get the full testing, and you need different treatment because I want you to feel your best.
Yeah. And I'm just going to ask you this, although you're probably going to say absolutely not, but is the levothyroxine, can anybody be optimal just on that?
I haven't met them yet. I'm sure they're out there somewhere.
Okay. Because, and that's what I've heard as well. I've heard, well, I'm better. My labs are looking better. And this is the feedback I get, when they share it with me during our sessions. And I'm like, well, and I can't argue that because and this is a question I wanted to ask you because I didn't know if there was a difference, but the human body's the human body. In theory, we all should be responding best on the full treatment, not, kind of halfway there.
Okay. I think it goes back to what you said earlier, though, about how we start convincing ourselves like, well, maybe we're just getting older. Right. And we start medically gaslighting ourselves. Right. And we start convincing ourselves that, well, this is as good as it's going to get. I am getting older and going through perimenopause and menopause. And, this is good. And so when you're asking your clients, how do you feel? Ultimately, you and I both want the answer to be absolutely amazing. I am living my best life ever. Like ever. I have abundant energy through the day. I'm not gaining weight, looking sideways at a brownie. I can kind of have a treat here and there and go on vacation and not be 10 pounds heavier afterwards. That's what I want to hear. I don't want to hear like, yeah, I'm doing good. I'm okay. No, good is not acceptable. Absolutely freaking amazing is what we want to hear.
Yeah. Now, what about somebody who's had their whole gland taken out? This happens too. Is there anything different with that sort of a situation?
No, it just becomes even more imperative that you're on a combination of T4 and T3.
Okay. Yeah.
So I'll throw out a quick stat that I heard. This is at A4M, and I really love this stat, although I would change the numbers just a little bit. So the stat is that only 2% of those with hypothyroidism do well on T4 only. 98% of us need T4 and T3, or sometimes T3 only. I would bring that up to like probably a 99.9% of us need T4 and T3. Sure. T3 combined, and only 0.1% does well on T4 only. But that stat alone tells you that the combination is imperative. And when you don't have a thyroid, you don't have the T3 production anymore. You have to add it in.
More imperative. Yeah, absolutely. Absolutely. And it's not that, because we tend to be a little, sometimes people are cautious about what they're taking, but there's no harm. Just do it, right? Find a doctor that's willing to listen and take this and, to take these steps. So, and these are the people that you help, that they've probably been to 5 or 6 doctors. They're coming to you and they're finally somebody's going to give me what I need. So how would a woman bring this to her doctor? So the ladies that are listening today, I'm sure the light bulb's going off and they're like, so how do you do that? How do you advocate?
So I have like full sections in the book on exactly, number one, how to find a doctor. And this isn't what you've heard on Facebook, like call a compounding pharmacy, blah, blah, blah. No, this is you doing some legwork. And I give you specific questions to ask, whether you're calling a conventional doctor or whether you're going to sign up for a functional medicine program. There are certain things that I want you to ask to make sure they answer the correct way before you hand over any money, whether it's a copay or a couple grand for a program. I want you to ask these questions and make sure they're answered properly. Then I teach you actually how to have that conversation with your doctor when you go in with your labs, because you are going to learn what your labs mean. So the purpose of the Thyroid Fix is to empower that patient to know their labs even before they walk in. You know, you get your labs done, you look at them, you reference the book, it teaches you exactly what you need medication wise. And then you can go in and say, hey, Dr. So-and-so, okay, my reverse T3 is a 20 and my free T3 is a 2.5. And I'm on 50 micrograms of levothyroxine. So I really think we need to bring that 50 micrograms down to 25 to lower the reverse T3. And we need to add in T3 in the form of liothyronine at 5 micrograms twice a day. And I probably am going to titrate up to about 15 micrograms twice a day. Are you on board? Are you collaborative? And they're going to go, holy cow, did this person
know more than I do.
Whoa. And you're going to blow their minds a little bit, but they're also going to respect you for knowing if it's a good doctor, they're going to respect you for knowing exactly how your body is working. This isn't you going to Dr. Google. This is you getting educated and empowered to have that kind of conversation with your doctor, who should be collaborative in your care.
That's right. That's right. That's right. It needs to be a team effort. Absolutely. Yeah. And again, if they're not willing to listen, you go find another doctor.
Yep. Exactly. Exactly. I
Like-
mean, you can
like
come work
we
with us
said.
at any time.
Yeah. Yeah.
You know, I mean, we got
absolutely.
you covered there. But if you want to try the doctor down the street, you know, I get it that people want to stay in the insurance-based system for a while.
Right.
And you can try. I mean, I give you the power to in the Thyroid Fix. You can try. And then when all else fails, if you can't find that diamond in the rough, then, you know, then you can always come to us.
Yeah, absolutely. Yeah. 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 Just know that there's options.
Yep.
So many of my listeners, I want to kind of segue over to that wonderful thing called perimenopause and menopause. So how does estrogen, progesterone, and testosterone and the thyroid, how do they all interact? This is not talked about enough.
No.
And yeah.
It's not. We're getting, and I know you see this too, we're getting a lot more of a spotlight on perimenopause and menopause right now, especially with Halle Berry coming out, right? And Oprah and all the things. But we're forgetting about the master gland, and we're forgetting about this thing that women go through called thyropause. So we know that if you live long enough, you're going to go through hormonal decline. You're going to go through perimenopause and then enter menopause. And that's when you're basically in perimenopause, your progesterone starts to drop, and that can drop in your 20s, 30s, or 40s, followed by testosterone. And then your estrogen is going to go on like a wild roller coaster ride for a while before it falls off a cliff in menopause. So that period of hormonal chaos happens and causes the thyroid gland to kind of go haywire at the same time, because that hormonal roller coaster is a stressor on the body. And then that stressor will turn on a Hashimoto switch that's been in the off position for a while. It'll flip that on, because what do we know about autoimmune? Hormonal chaos, like in pregnancy, that's a big time that we see Hashimoto's or hypothyroidism diagnosed, or perimenopause, menopause, i.e. thyropause, is a time in a woman's life. It usually occurs after the age of 40, where her thyroid just kind of down regulates. It doesn't work as well. It either comes into full-blown Hashimoto's, which if you have type 1 diabetes, you are very, very prone to having Hashimoto's, where we see one autoimmune, we see more than one. And the thyroid is the canary in the coal mine. It'll respond to autoimmune like that. So we often see Hashimoto's and type 1 go hand in hand. So that's usually a time in a woman's life where she actually gets the diagnosis.
Okay. And it's probably, I mean, again, this all goes into lab work and paying attention to our symptoms. One of our ladies, and again, I'm not mentioning their names today, but they're going to know who I'm talking about when I mention it. But she came in with all the classic symptoms. It could be either menopause related. She was in menopause, wasn't on hormone replacement yet, very interested, all in. But she also felt extremely tired, which again, we talked through that. And again, all those symptoms that you mentioned, it was wonderful to be able to again talk through it with her. And she realized that her symptoms, she really intuitively knew her thyroid, there was something wrong with it. And again, she'd never been diagnosed. And she got put off. The tests never came back conclusive in their case. And they were just telling her to come back in 6 months, if you can believe it, where she was, where she could not even stay awake during the day. She was so tired. Blood sugar was a wreck. So what she did, and I would love your opinion, because this might be something where, okay, well, which one do I fix first? And she did decide to go after, to tend to her thyroid first and to dial that in. And then it wasn't too much longer after that, she was working with the same practitioner, which was really nice. They brought her on board with hormone therapy.
Mm-hmm.
And she, again, as we speak, she's still trying to get it all dialed up and optimized. So would you say that that's, like you say, it's better to maybe, to look at one thing, because you don't know, like if you're taking any sort of hormone replacement or thyroid replacement, if you're taking them all at once, you don't know what's fixing one, right? Because they kind of overlap, don't they?
They do, but since they play in the same sandbox, we like to do both at the same time for two reasons.
Okay.
Number one, women like the one you just described, they've been suffering for so long. I can't ask them to wait another 6 months to feel their best.
Yeah,
I want to give
know
them a win right away. And if she's dealing with hot flashes and vaginal dryness and brain fog and anxiety and insomnia, let's get a win. It's not going to hurt to put in the hormones at the same time as the thyroid. In fact, they work together. So progesterone will help your body convert T4 to T3. Testosterone will give a layer of protection against worsening autoimmune conditions. So it'll help to lower inflammation and lower antibodies. And then it'll work in conjunction with the right thyroid treatment to help change body composition and protect muscle and improve libido. And so it's about that quality of life given really quickly that helps that patient be more compliant with the overall plan. Whether it's taking thyroid and hormones, cleaning up their diet, getting good sleep, getting some movement in, it really helps them be more compliant, because if she's not getting a win in the beginning, she's going to go, why am I even doing this? Like, is this even working? And I don't want to be the one to be like, well, you got to wait another 6 months to do hormones. No, let's do them all at the same time.
Right. Let's start really, let's get the ball rolling and get that stuff. Well, really good. Awesome. Well, that's awesome. I love that. So what about when we talk about hormone replacement, when we do bring that in? So if a woman is living with diabetes, we're still living with diabetes. So that's another whole part of this equation.
Right.
And what are the symptoms that, you ran off a lot of the same symptoms, and you did already point to the fact the thyroid does impact insulin sensitivity. And that's one of her biggest things that she was suffering with, is she was more resistant, needing more insulin. So, again, it's all in the same basket, really. And it's sad to say it's so to the point, but I think once we know, it does help understand it. It's a little more understandable. So what happens if you are, let's say you've been on treatment for thyroid for years, although we don't know, listeners, or maybe some examples that we've talked about today, what sort of treatment that they are using. They might still only be on the levothyroxine, the T4. And then they bring on estrogen, progesterone, maybe even testosterone. And because I have seen studies, and then, I've seen it written where your thyroid is something you need to keep an eye on even more once you bring in those other hormones, because it may, again, the TSH is the one thing they're looking at, even though you say it's not as important, but that's that one marker that does start to climb up once they bring in the estrogen. So are you seeing evidence of that? Is that something that they need to consider, or their doctors need to consider?
Yes and no. So
Okay.
if we unpack that, when you bring in estrogen, number one, it depends on the delivery method
The
of that
delivery method.
HRT. So
Okay.
we personally do not ever use oral estrogen.
Mhm, mhm,
We find that increases risk of blood clots, and it increases something called thyroid binding globulin. It also
mm,
increases sex hormone binding globulin.
mm.
So oral estrogen is notorious for that as birth control. So if we're using the patch or a cream, which is standard of what we use for hormone replacement, bioidentical hormone replacement, we're using it at a dose to bring her estradiol level into that optimal range where she has the bone, brain, breast, and heart protection and symptom relief, but we're not taking it to a level that's going to increase her thyroid binding globulin, which will
Mhm.
then come back and impact thyroid hormone because it will bind to the free T4 and T3 and bring those down. Now, if we're managing her thyroid at the same time and we see a little decline in those hormones and she reports the symptoms associated with the decline, we just adjust her dose. If
Yeah,
she's over
yeah.
here feeling amazing and her estradiol is a 120 and she's, living her best life, but we see her free T3 start to drop over here, just increase her dose of T3, make sure that it's
Gotcha.
tolerated, make sure that that
Uh-huh.
improves, the numbers in her symptoms and all as well. So it's really not something that you have to be overly concerned about
Okay.
unless, of course, you're on birth control or oral estrogen. And I even talk about birth control in the book too.
Okay.
And I say, like, listen, if you're in midlife and you're using birth control, it's time to stop because we got to find a different method of protection. Birth control just has too many side effects. It increases your risk of hypothyroidism. It increases SHBG. It just has a host of issues to
Okay.
it. Now, if you're in your 20s, your 30s, you don't want to I get it. I get
Yeah.
it. Use the birth control during that time. But once, we grow up and we're in a monogamous relationship or whatever, let's figure out a different way because that
Yeah.
oral birth control just wreaks havoc with your body.
Yeah, yeah, that's a really good reminder. So what kind of, because I know that you're big on lifestyle too, and we are too here on this show, and the way that we talk, throughout the different guests and stuff that we bring on here. So what are the things you mentioned it here just a minute ago? Reducing stress, sleep, protein, nutrients, movement, all the things, and obviously inflammation. Gosh, that's a hot word, isn't it?
It is. It is.
Yeah. But we know I love the word terrain. We got to protect the terrain. We got to keep that foundation the best we can. It helps everything. And obviously when we're bringing in hormones, whether it's thyroid, sex, the sex hormones, and insulin, of course, is a hormone, all of these things, it does optimize everything. So it's really setting down that kind of that base, isn't it?
It is. And, I always say we can't put hormones on a dumpster fire. So you have to build that foundation so that when we bring in those beautiful life-giving hormones, they do their job and they do it to the fullest and they do their best
Yeah.
job.
Yeah.
So yes, that baseline lifestyle foundation that we all talk about, it really is key.
Yeah, it absolutely is. So what's one thyroid myth you wish would just disappear?
Relying on TSH. Just throw it out. Let's just
It goes
remove
back
it
to
completely.
let's forget about that. Let's
Let's
forget
just
about
toss
that.
it out. TSH causes more misdiagnoses than any other
Mhm.
lab marker,
Mm.
and it's unfortunate.
Yeah, yeah. Again, because they're not looking at the full panel. Absolutely. Okay. Well, so if someone, one of our listeners here, something isn't, something's not feeling right, they keep being told everything looks normal, and you've kind of touched on this. What encouragement would you leave for him or her?
That there's hope. That's the biggest thing. So I think back to my journey and I think, what if I would have stopped at doctor number
Right.
4 or doctor number 5? Like
Right.
5 white coat medical professionals are telling me that I'm normal and everything is fine. So who am I to think that there's actually something wrong with with my body? Well, you
Right.
know your body and you
Mhm.
know your body better than any white coat. So the biggest thing is to listen to that intuition and you keep going. You never ever lose hope. You don't throw in
Mhm.
the towel. You
Mhm.
will find help, whether it's me, whether it's somebody else, whoever it is, you're going to get the help you need. You
Yeah.
just have to hold on to that hope and don't give up.
Yeah. 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 I appreciate that. And I appreciate you being here today. You are a wealth of knowledge. I'm going to get my hands on that book as well. So I'm going to put that, I'm going to order one of those myself. My husband is that's something that he's treated for, is thyroid. And he also has type 1 diabetes.
Okay.
How about
Okay.
that? How about that? So yeah, it's very interesting. And he just recently found, with my nudging, you know how it is with a husband, I give him
Yes.
ideas and suggestions, and he knew that there was something off about his, the whole levels. And I just kept nudging and nudging. He did find a practitioner here, mid Florida,
Okay.
who is functional, runs the full panel. And guess what he prescribed him? The levothyroxine, well, which is what he already had. He dosed that
Right.
down, and he put in, it's the NP
Yeah. Yeah.
T3, which is another
Desiccated.
way. Yeah, the desiccated. So, and guess what? Things are looking better. And it does
Better.
take a little time too, doesn't it? I mean,
Yeah.
this is not like just hitting a switch. It's definitely, but it's just, it goes to show you, when you're getting proper advice, treatment, and a doctor who knows what they're doing, basically, you're going to feel better. And your blood sugar is going to affect that as well, too, which is our goal here. So
Very true.
awesome. Yeah. Well, tell our listeners how they can connect with you.
Absolutely. So you can go to dramie.com. And from there, if you're interested in becoming a patient in the clinic, you can book a free call, totally free. We're just going to go over your health history, go over what you've tried, what you haven't tried, what you're taking right now. You don't need labs for that call, but we do kind of want to review what you're already doing. And then we can go over the different options that are available to you. And then from there, you can also find the Thyroid Fixer podcast. I talk about all things hormone, thyroid,
Yeah.
weight loss, all the things on that show. And then you can go to betterlifedoctor.com. That is the Fixer formula line, where we have T2 that increases your basal metabolic rate. I don't know if you guys use berberine at all.
So,
We've used
yeah.
berberine in type 1 diabetes, and that helps as well.
Mm-hmm.
So that's another
Yep.
phenomenal supplement. It's in my blood sugar fixer that I add in for
Absolutely.
all of our type 1 diabetic patients too.
Yes.
Yeah.
Great reminder. Thank you. Yes. Well, thanks again for being here. And please share this show. Dr. Amie Hornaman, she's got some amazing resources and knowledge, and we want to make sure more people hear this information. Very, very important.
Yes.
And
And
we'll
get the book, because that's going to help
get the book.
tremendously. Get the
Yes.
book. It's
That's
on
right.
Amazon. The Audible's great because I give bonus content at the end of every chapter. So
Love
grab the
it.
hardcover, grab the Audible, and have fun with it.
That's right. Right. It's a reference that you need.
It is.
You
It
or
is.
somebody you know for sure. Well,
Yes.
thanks again.
Thank you.
Okay. Y'all have a beautiful day.